Hello, everyone. I am Dan Taylor, Director of Communications for the Association of the United States Navy. Thank you for joining us for our latest in a series of Navy Now webinars. Today, our topic is going to be retired activities offices, and we have a excellent guest, Paul Dillon, who is Master Chief who retired as Master Chief in 1980. He served for 24 years. He retired as Master Chief Radioman. Has 21 years of experience with retired activities offices, and he is currently the president of the AUSN Nautilus Chapter. He is joining us live from Connecticut. So I know you have a series of PowerPoint slides. So why don't you just go ahead and talk about what you would like to talk about.
Well, good morning, all, and happy Valentine's Day to all. And it's a pleasure for me to be here this morning to discuss retired activities and what we do and help our fellow retirees. And I think we're going to be looking at some slides. Here we go. So basically, retired activity officers are in service to our retired community. And what do I mean by that? Well, we're getting ahead of myself, but backing this up, RAOs were established, as you can see, in 1981 under the Department of the Navy Activities Program. So we're mandated by both SecNav and Chief of Naval Operations Directives. The mission, simple. As I mentioned, the basic simple statement is in service to our retired communities. And if you look at the next slide, this is some of the items that we're in business to help retirees with, whether it's healthcare, pay-related, death benefits, leisure. And I'd have to say, Dan, that death benefits might be the leading issue that we get involved with.
Right.
So it's important that folks out there know that we're available throughout the country. Within the Navy, there are 28 retired activity offices scattered around the country and the world in general. For example, we even have an RAO in the Philippines and also in Spain. And they're there just to help retirees that don't know what's going on.
Right.
And the average age of retirees right now, believe it or not, is 65 years. And how many retirees do we have military-wise? We have 2.6 million of us that are being paid every month by DFAS. We'll talk about that a little bit later in the presentation. So Dan, you have any questions at this point?
No. So I guess you're going to go through each of these: healthcare, pay-related, death benefits, and leisure, and these are sort of the four main areas that people need to be focused on.
One of the things that we have, the healthcare issue, is the TRICARE program. And it's really a gift. If you look at TRICARE, which is available to retirees, okay, the retiree under 65 has options. For example, TRICARE Prime, depending on how far they live from a military treatment facility. There's TRICARE Select. Then we get into the reserves and so forth. We got TRICARE Reserve Select. Additionally, young adult, TRICARE Young Adult. What's that one all about? If your child is enrolled in TRICARE and is not going to college, you can enroll them in TRICARE Young Adult, and they can stay on that program until they're age 26. So that's a very good benefit, very reasonably priced per annum price. For example, for TRICARE Prime is $600 per year. Yes, there are copays, but they're not very expensive copays.
Right.
So if we could move on to that next slide.
Okay.
It's very important that retirees know about the Defense Enrollment Eligibility Reporting System, DEERS. And once you retire, you have some responsibilities to keep your record up to date. And those include a sponsor status change in marital status, change of address is very important, and becoming eligible for Medicare. And of course, the death of a sponsor or a family member. They all affect your DEERS. DEERS controls your TRICARE benefit. If I may tell a little story at this point, about 3 months ago at the RAO here at Groton, we received a call from a retired Chief Petty Officer. He was distraught. Why was he distraught? Because of the fact he was just told that his TRICARE benefit is no longer in effect. So after looking into this, we found that he had missed a couple of billing statements. Why did he miss his billing statements? Because he never reported his change of address to DEERS. DEERS, again, controls your TRICARE. So since they couldn't reach this chief, they just terminated him from the TRICARE benefit completely.
Right.
Well, fortunately, we were able to get involved and help him get reinstated. And so that's why it's important to keep your record up to date with DEERS.
Yeah, and I did wonder that, actually, if I could interject. You mentioned DEERS and DFAST when you change an address or you have changing contact name information or name or a status. I mean, how many different agencies are there to notify? Is it just DFAST and DEERS, or are there others that you need to make sure to update?
We're going to get into that, of course. If you have a VA disability, you need to keep the VA up to speed as well on any changes. And they call them qualifying life events. And basically, as I mentioned, sponsor status, marital status, change of address, and there's a few others in there as well.
Okay.
Okay, moving on. Slide. Okay, I put this one on here because, again, we talk about TRICARE and so forth, but the one at the bottom, Retiree at Cost Hearing Aid Program. Just because you are a veteran doesn't necessarily mean if you need a hearing aid that the VA is going to give you a hearing aid at no cost. The 2015 Defense Authorization Act authorized hearing aids to be dispensed to not only retirees, but their spouses at cost, which means you probably can get a hearing aid for about $500 to $600 at a participating military treatment facility. For example, here in Groton, the Naval Branch Healthcare Clinic on the base will see the military member, but not the spouse. But 40 miles away is Naval Branch Healthcare Clinic in Newport, Rhode Island. And they will see spouses and outfit them with hearing aids. So that's a big benefit. If you're not aware of it out there, you are now aware that they have a retiree at cost hearing aid program. So again, if you live in an area and your clinic or hospital does not provide the service, check the next one that's closest to you. You might find that available. Okay. All righty. I put this one up here because those approaching 65, as it says, you'll receive your Medicare card 3 months before your 65th birthday. So what's important with this is when you're eligible for TRICARE for life. But without your ID card being updated, that TRICARE Life for Life is not going to kick in. So you must go to your local ID card issuing area to get your new updated military retired ID card. And if you go to your next slide, can by any chance click on this website that's listed here?
Absolutely.
If I can just ask real quick, Paul, Master Chief, can you describe what to do if someone leaves their you said that you should always have your Medicare card on you. If someone leaves it behind, I mean, what is the sort of complications that can arise from that, and is there any sort of recourse?
I'm sorry, would you say that again, Dan?
Well, if someone does not have their Medicare card on them and they go for a visit in the hospital, I mean, can that information be recalled some other way, or is there some complications that can arise from that?
That's a good question, and I really can't answer. I really don't know because I've never experienced that.
Right.
I know people my age do carry that red, white, and blue card with them at all times.
Right. Yeah. So best to not find out, I guess.
I'm assuming that that if you didn't have the card, that they are able to access that in an emergency room type of deal. And apparently, we can't open that that website, Rapids. But
yeah, we'll post it on. We'll post all of these PowerPoint slides on the website. And
yeah. So I just wanted
to access it.
Just wanted to point out, if you're living in an area and you don't know where your local or nearest military base is, just remember the Rapids. Just Google Rapids alone, and that will bring you up to this this website that will lead you to your nearest ID card issuing area. For example, here in Groton, not too long ago, I had a call from a retiree who lived in the state of Maine. Because he retired from submarine base in London, he thought he had to come back here to update his ID. No, not true. Just go to Rapids, and we found one like 10 miles from his home that he could go to. National Guard issuing areas, Naval Reserve sites, and so forth. Take care of these little issues with IDs.
Right.
Okay.
So a lot of that can be done online these days.
You have to look for it online and then visit that particular ID card issuing office. But the important thing is, remember, the new ID card is required for TRICARE for life. If you're not up to date, because again, it's a DEERS issue, you're not in TRICARE for life. So get that card updated at age 65.
Can you see the website now? I think we got it up.
Okay.
Can you see it, Paul?
I'm not seeing it here, so we can move on, I guess.
Oh, okay.
Long-term care. It's a hard thing for families to understand that at some point in time, a majority of folks growing old are going to require long-term care. You got to remember that Medicare, I'm talking us over 65, Medicare is not going to pay for long-term care. They might help you for 100 days of care, but after the 100 days, the family is on their own. So this is a benefit that's listed that website at the bottom of this slide that you might want to go to and take a look at and so forth. Remember, the younger you are, the annual fee is a lot cheaper. Personally, I have long-term care. I've had it for a number of years. And it's just a great feeling to know that if I go into a long-term care facility, they're not going to be taking my house away from us.
Right.
So take a look at these websites. Hopefully we can make those available to you later in the program, so forth. But you're never too old. You never know what's going to happen.
Right.
Matter of fact, there's just a recent study that more and more people are coming down with Alzheimer's at age 60 now than ever before.
Right.
All right. I put these up for the healthcare for those who have incapacitated children. There's a program called Secondary Dependency, and it allows the dependents to be covered under TRICARE. You know, this could be for life, depending on how badly they're incapacitated and so forth. Also, the Special Needs Trust for direct payment of SPP for a dependent child. Take a look at that on DPAS. The website is given there, but it's an important thing that you do if you have an incapacitated child to know about the secondary dependency as well as the Special Needs Trust, and that will protect these children for their lives. Thank you. Any questions on that?
No, we can just we can move on to MyPay.
Okay. MyPay, of course, most of you folks viewing this webinar hopefully are enrolled in MyPay at DPAS because it's the way to go. It allows you to control your pay. It allows you to change your address. It allows you to change your tax holding and so forth. It's a great program to be involved with. Unfortunately, if you look at the MyPay for us retirees, only 55% of retirees people are using MyPay. And the average age of those retirees is 65. And the same thing goes with annuitants. The annuitants are those that are drawing survivor benefit SPP payments. And with them, the average age is 77, and only 11% of those annuitants, only 11% use MyPay. So I seriously encourage you to use it. It certainly expedites you receiving your 1099 because that's just go online and download it and you got it. Also the 1095, which is the Accountable Care Act form if you need to file your taxes, that's there as well. So take a look at it, MyPay.
Is there any, what would you advise if they're not on it right now? Is it as simple, you just go to the website and you sign up for it, or how does that work?
That's correct. You log on, you simply log on to DFAS MyPay, and you look on the upper right part of the screen, and you'll see log on information on that. Below all of that, it'll say create an account. And just click on that, create an account, and they'll walk you through it. And it's the way to go, really.
Okay.
And the same thing with as DEERS and so forth. It's very important that you keep DFAS up to speed on your address, phone number, and email address, as well as change of life. It's marriage, divorce, children, graduation, and death. So these folks need to be informed when these things happen, because it's your account and don't let it get messed up. Okay. And we often get calls in our office, quite a few calls, believe it or not. I don't have my DD-214. What do I do? Well, there's a couple of ways you can get your DD-214. For recent retirees, you should be able to go to the VA website, e-benefits. It's Echo Benefits, and you should be able to find your DD-214 on that website. The second way is, of course, to go to the National Archives, and the website is given here on this slide. Thirdly, you can mail a letter using a standard form 180 to the address shown on the screen, National Personal Record Center, 1 Archives Drive, St. Louis, Missouri. One of the ways we do it here in Connecticut, in my congressional district, is to simply call the veterans advisor to your local congressman and say, hey, can you help me get my DD-214 in an expeditious manner? And typically they'll help you get that, and within a week you'll have it. By using the write-in thing and so forth, it takes about a month. And but the bottom line is, hopefully you don't know, you're not going to lose your DD-214. You're going to keep that in a safe position. Here in Connecticut, we're fortunate that we can file our DD-214 with our local town, our city hall. We actually get a tax exemption on our personal property, whether it's our home or our vehicle. Okay.
Yeah, and that's one thing I wondered. What's the sort of the common reasons for not having them? Is it, do people sometimes not realize how important they can be, or they just, misplace them?
Yeah, correct. The DD-214 is a very important document. And basically, for example, when you pass away and you want to get veterans benefits, you better be able to produce that DD-214. So that's just remember it. So it's very important. Okay. And this is important. It's military retirement does end at the date of death of the retiree. And that death should be reported to DFAS as soon as possible to prevent the overpayment of the retiree's pay account. So 2 ways you can do it, a number of ways you can do it. One is called 1-800-321-1080. Number 2, you can go on the DFAS website, and there's a form you can fill out on the web and so forth. Why is it important to report? Because of the fact that if you don't report it, it can carry on into the next month. And when DFAS does find out that your spouse or the military retiree passed away, they're going to pull all that money back. So get it done. It only benefits the beneficiaries.
Right.
All right. What is AOP? Managing your AOP. Well, military, we get paid day by day. Today being the 14th of February. If I pass away today, my wife's entitled to 14 days. So she is my arrears of pay beneficiary. Now, keeping DPAS up to date on your AOP beneficiary is extremely important. I have dealt with many cases, believe it or not, that the military retiree remarried and he never changed his beneficiary with DPAS. In those cases, DPAS says no. In other words, they got to pay that first wife. So you have to pay that arrears of pay to the first wife.
Right.
So you must make sure that the arrears of pay beneficiary is up to date at all times. And again, it's done through either calling the 1-800 number, or hopefully you got that MyPay, you can make that change to my MyPay account. Any questions on that one?
No, not at this point.
Okay. All right. The 2020 National Defense Authorization Act just changed the thing that we've been fighting for many years. In other words, if a military retiree has survivor benefits for his spouse and he passes away, from a service-connected disability, the spouse is eligible for dependents indemnity compensation. Heretofore, the spouse could not have both SPP and DIC. In other words, the DIC would offset the SPP. So the National Defense Authorization Act of 2020, which was just passed and signed into law, has removed that. However, it doesn't really take effect until 2021. And then it's going to be a slow phased-in approach to paying both DIC and SPP to qualified widows. So the most important thing that SPP annuitants can do right now is to make sure that their annuity account information is up to date at DPAS, either by calling or hopefully you've got a MyPay account. So any questions on that, Dan?
So essentially, they can do all of this through MyPay. If there's any change of
That's correct.
address, they just do it through there.
Yeah. Mm-hmm.
Makes it simple.
Okay. And folks should understand that not only there are national burial sites, but just about every state has a state veteran cemetery as well. So just be aware that you are eligible to be buried in these areas. Now there's changes becoming to Arlington, and I'm not really up to date on that. Maybe Dan, you're up to speed on the Arlington requirements that are coming forth. But if you're looking, estate planning, now's the time to take a look at what's available to you when you do pass. It's very good benefits and so forth.
Okay.
And of course, burials at sea, another option. We just handled one here in Groton last week. The individual will be going out of Norfolk, Virginia. And of course, these are cremains. And but if you go to this website, that will explain the whole program to you. But the retired activity officers are there to help you and assist you in doing all the stuff that I've been discussing here this morning. So burial at sea is an option for many. They go out and they do a great ceremony, and the widow, next to family, they get a video and a certificate and so forth of that ceremony that took place on that given ship. But those,
are there any special requirements for this, or is this just to anyone who requests it?
any qualified individual, not a spouse obviously, but
right.
But the individual, the retiree, military retiree. Again, it has to be cremated. The individual has to be cremated, and there's particular shipping instructions that have to be followed when shipping those cremains. And that's why I say you should go to the website, and that will give you those directions.
Okay.
Big benefits, flying space A. Where do you want to go in the world? The thing is, now that you're retired, you're now a priority 6, category 6 on the category list. My wife and I have flown to so many places. For example, we've been to Europe, I don't know how many times. I live in Connecticut, where we did fly to Japan to see my son out in Japan. It's a great benefit, and just if you got time, take a look at it. And the website you want to really go to is the one at the bottom. That's the one that lists what's going on. Unfortunately, after 9/11, Air Force bases will only list a 72-day window on where their flights are going. And as a retiree, you're a Category 6, as I mentioned, and you can plan your trip. For example, if you want to go, well, you want to go to Europe, take a look in 60 days from now, it might be your target date. Well, send in your requests within, say, 40 days prior to your trip, you want to go and so forth. But we're available here at Sunbase in London to answer your questions on this, and we'd be glad to help you with the Space Aid benefit.
Yeah, that seems like a really fantastic benefit. And so they would go to that last website, I assume, to set up the travel arrangements and look for availability.
Yep. So go to that last website on the Air Force, and they'll tell you what's going on. And don't forget military lodging. The Air Force particularly has some great lodges. Little known fact, there's Niagara Air Force Station, 20 minutes from Niagara Falls. They have a beautiful lodge, and I think the rate's only about $70 a night, but it's something to look at when you travel. Take a look at military lodging. Now we can talk about the military resorts too, and you've probably already heard of the one at Disney World in Florida. My wife and I stayed there a few years back. Another one we went to was when we were in Japan. We did go to the new Sano Hotel right in the heart of Tokyo. Beautiful 5-star hotel. So you've got all these benefits out there for you folks, and hopefully you can take advantage of them soon. Okay?
Right. Great.
Same thing with the Halico Hotel. We've stayed there and so forth and so forth. One important thing we find so often, so many times, that a widow has come into the office and she says, "Can you help me?" And the question is, how can I help you? Well, my husband passed and he didn't tell me anything. I don't know where his records are. I don't know anything about his pay. So where I'm going with this form here, this screen here, as a retiree, create a checklist action item, and what's listed there, make sure your spouse knows what's going on. Just recently, I had an 85-year-old widow come in, and she said, "I'm at loss." She said, "I've never even written a check." At 85 years old, her husband did everything for her, but also he never told her where his bank accounts were. It's so much true. Right. These are true stories. So take a look at this and take care of it for your spouse. All right. Now, so many people really don't know what their VA benefits are. It's really sad that they really don't. Number one, if you have a disability, does not mean that you're enrolled in VA healthcare. You must be enrolled in VA healthcare to take care of some of these benefits they're talking about. We talked about long-term care a little while ago, but did you know that the VA has what they call community care living, CCL? You may be eligible if you require, long-term care to take advantage of that benefit that the VA has. It's called community care living, and you have to meet certain criteria to meet that. But and it's not in a VA rest home. There are rest homes, nursing homes in your community that are under contract to the VA. So that's a big benefit if you're eligible. But I do encourage retirees to enroll in VA healthcare, even though you might have a great program at work or something like that. It's just to protect your overall plan, if you will.
Right.
So take a look at also some of the benefits that you'll have, even a burial benefit. If you have a disability, for example, did you know you can get a burial benefit in money from the VA in helping in the expense elements, but you have to have that VA disability. That ranges from 0 to 100%. When I say 0, the VA actually has 0 rated, but you're compensated, for example, hearing loss and so forth, but that counts.
Right.
All right. And this is true too. Hold on. Get back to that last slide, if you would. VA disability ratings are not always permanent. You might be rated at 60%, but you're going to have a comp and pen exam, and it's going to change because you got well. So you might lose the benefit. You might be reduced in payment. Change in family status, very important, just like we talked about keeping deers and so forth and so forth. If you're getting a VA disability and you're over 30%, you can claim your wife as a dependent and you get extra dollars in that VA disability. But let's say your wife predeceases you, notify the VA, because if you don't, they're going to find out and they're going to take that back, and it could be a big chunk of change by the time they catch up with you.
Right.
Any questions?
No, and also I just want to mention that the viewers, I mean, obviously there are a lot of links that we have here. This will all be available online, so you can check these out. A lot of great resources here, so we'll make those available.
Okay, that's good. All right, what else we got here? And a lot of folks aren't up to speed on what their respective state can do for them. I mentioned here in Connecticut, by filing your DD 214, you don't have to be disabled, but just serving in the military, you can get tax benefits from the state in your hometown on both your property. It could be your vehicle, it could be again a home. And then here in Connecticut, we have tuition waivers. Those getting out of the military can go to college here in Connecticut at no charge. And so just encourage folks to know what their state benefits are, and those include burial benefits too.
Right.
Yeah. And if you need, for example, and there are people who do need financial assistance, grants or loans, take a look at your nearest Navy Marine Corps Relief Society. Here at Subbase, we do have an office and so forth. They're there to help in the event that you do have a financial need. It's a great service. Another one is visiting your local JAG officer on your given base. Why? They will do wills at free of charge. They'll do powers of attorney at free of charge, and also consult with you with some other legal things at free of charge. Additionally, military appreciation days, we call them RADs, Retiree Appreciation Days. They're done throughout the country. They're done annually by a given basis. For example, here in Groton, we're doing our next Retiree Appreciation Day on October 17th. In those RADs, we have speakers of interest that provide everything from legislative update, TRICARE healthcare, the VA, and etc. They're very, very informative. So hopefully you'll find one in your given area and you will attend. Now, lastly, Ship Colors is a Navy retiree newsletter. If you have your email address up to date with DFAS, DFAS will send you a notification that the latest copy of the Navy retiree called Ship Colors newsletter is available. They'll give you the website, go to it, click it, download the Ship Colors retiree newsletter. It's got a lot of good information that brings you up to date on what's going on with retirement issues. So, question?
All right, yeah, so I had a few for you. I appreciate that. That was a lot to get through, and I think we did a pretty good job with that. So I wondered first if you could talk a little about retired activities offices themselves. Do you think people are aware that it exists, enough people are aware that it exists as a resource, and how can they find out where theirs are?
Well, first of all, within the Navy, Air Force, we're all volunteers. Retired activity offices are all staffed by volunteers. The Army is a little different. They call them retirement service officers, and they're actually employees of the Army. And how do you find an RAO? Well, as I mentioned, if you subscribe to Ship Colors, you'll find that each copy of and that comes out quarterly, by the way, that there, can you see this? All right, but they will list all the Navy RAOs here in their periodical. And the other way to do it is if you live next to a retired military base, obviously give the base a call and say, hey, do you have a retired activities? For example, in your area, sad to say, there's no Navy RAO in the Northern Virginia area. There is an Air Force RAO at Andrews Air Base. There is an Army RSO at Fort Belvoir, but there's no Navy RAO. Just because you're a Navy person does not mean that the RAOs that the other services have will not help you. They do. We're all in it for the same purpose, to help the retiree. And as far as how do you find one, as I mentioned, wherever you live, Google your nearest military base and see if that comes up. Just key in RAO or, Fort Belvoir or whatever.
Right. What would you say are there any misconceptions about what RAOs are able to do and what services you provide?
That I don't believe so. Through our retiree appreciation days, and for example, here in Connecticut, we have 14,000 retirees. We normally draw to our RAD 500 to 600 retirees. I would say the majority are well aware of RAOs, given the fact that it's sub-base how many folks that we service in a given year.
Right.
Primarily what we serve primarily are the widows. And that's the saddest part about it. Again, I mentioned how many don't know anything because their husband didn't say anything. But when a service member passes, we're there to help that widow. There's a number of things that has to be done, reporting agencies, DFAS, DEERS, and so forth. But with that comes forms, paperwork. Sometimes that paperwork can be very complicated to an 85-year-old woman. Right. We're there to help her get through that. So that's one of the biggest things we do, is assist the widows. Right. And then, of course, we have what we call direct liaison with DFAS over and above the 800 line. So we can work directly with a liaison at DFAS if there's a given problem. For example, we had one, husband passed away. Oh, what was it? Her husband passed away, and somehow, whomever she talked to, they reported his passing as November 14th. When in reality, he passed away in January 14th. So she was short pay. Yeah. Worked with a liaison to get that corrected, which we did. And now she has a full SVP and so forth.
Right. Is there a need for volunteers at the? I mean, you said it's an all volunteer sort of operation. Is there a need for people to come in and help out?
Definitely a need for volunteers. We're doing pretty good here in Groton. We have 10 that part of my crew. However, there are other RAOs out there that, matter of fact, let me put it this way. Newport, Rhode Island. Rhode Island has a large retiree community. Their RAO shut down. We are now covering for the Rhode Island RAO. There's been attempts to reopen it, but again, you just can't put one guy in there. We need to build that up with other retirees because we're typically run Monday through Friday, and so forth.
Can you launch an RAO on your own? Do you need approval from the Navy? How does that work?
We need approval from Millington, Tennessee. It's OpNav 170 in Millington, and they're the people we report to. They set the directives up and so forth. And how does one become an RAO volunteer? Well, there's no formal training. It's like, here you are and so forth. There is a desktop training guide that's promulgated by Millington, Tennessee again. And of course, the instructions and just on-the-job training, because you never know what the question's going to be or what the task is going to be when somebody comes through the door or that phone call. Yeah, good.
Right. We talked a little bit about changes that we require notification of DFAS, so you don't have any issues there. We mentioned change of address, changing your name. I mean, what are some of the things what are the changes that people should, reach out and notify the appropriate agencies about?
Okay, good question. Well, what do you think about that one? So
we know we have address, we know we have name, and I think there was status too, wasn't there? Is it like marital status? Is that something that you would need to update or?
Marital? You mean like divorce?
Yeah, something like that. Anything that would, I don't know, maybe result in some change in benefits or.
Yeah, that's an interesting question. For example, there is a form of Spouse Protection Act that protects a spouse in a military marriage. However, there's some stepping stones. Number one, it has to be 10 years. That the spouse has to be married to the military member for 10 years. And at that juncture, the courts can decide to split, award money to the spouse. But then we move on to the 15-year mark. If the spouse is married to a military member for 15 years and they're divorced, again, the court can divide retirement money at the 15 spouses. And the spouse gets to keep her medical benefits for 1 year with an ID card.
Right.
Then you move on to the 20-year mark. So it's 20/20 rule. When you're married 20 years, 20/20, the spouse now, this is the estranged spouse, she gets the money, but she also can keep her ID card with medical benefits for life, unless she remarries at an earlier age.
Okay, great. Going back to healthcare as well, you mentioned there are some medical conditions that may prevent coverage, and to check to see if that applies. I mean, if there is a situation where, because of that medical condition, someone is unable to get coverage, are there any resources to help them there, or are they, I mean,
You're talking about a VA
insurance, or?
You're talking about a VA disability?
Yeah.
Okay, so the VA, let's talk about Agent Orange, for example. There was a battle that has been fought for many, many years with the Blue Water Navy. Finally passed into law last June by President Trump. The issue is you got to prove to the VA that you were on a ship in that blue water area, which is 12 miles from the nautical miles from the demarcation point. So once you prove that, and how do you prove that? Well, number one, you got to, again, somehow prove you're on the ship during that time. Hopefully the DE-214 will delineate that. If not, there's other issues like cruise books, letters from former shipmates, and so forth. Once you get that, and the VA comes in and they'll say yes, no. So let's assume they say yes, and they rate you for like 20% for a given illness. If you're not happy with that, you can appeal that. You go through an appeal process. So it's a long, drawn-out issue, so forth. But I had one shipmate of mine, prostate cancer was blue water issue, or Agent Orange issue. He finally got approved, and it took him 6 years to get that approval. But now he's in the system. But the big thing is the VA will always back pay you to the date of your original claim. So he got a pretty good payday, if you will.
Yeah, I'll bet. So I just have one more question, then we'll sort of wrap up. I wanted to go back to, what happens if a retiree's account is overpaid after their death? And, I mean, if it sits around for a few months and they aren't notified, I mean, is there a risk of the DFAS will have to do collections? I mean, what's sort of the risk there?
Again, if you don't file that death notification promptly, the DFAS will, because most of it's electronically transmitted, direct deposit, and that's a requirement, as you know, direct deposit. They simply go to that bank and pull it back. And if the funds are already spent, obviously they're gonna come after you with the billing issue. But they will get their money.
Right.
And
so
then
it's important to keep on top of that.
Yeah, they'll eventually get it, and then it'll settle down, and you'll start getting if you have SVP, then the normal pay. Just ironically, I had a probably about 6 months ago, this man brought his wife in, and he looked at me and said, "I want you to tell my wife what she's going to get if I die." And I looked at him and asked the question, "Sir, do you have survivor benefits?" He goes, "No." I said, "Do you have veterans group life insurance?" The answer was no. So I looked at his wife and I said, "You're going to have an ID card. You'll have health benefits, exchange and commissary. That's it." He's, "Wait a minute. What do you mean?" He didn't understand that was it. He did not get into these programs that are available. So it is.
Right.
It's sad because I've had many cases, and one of them was a family of nine children, and he's very young. He's only out of the Navy 4 years, and when he passed away, didn't leave any of it.
Right.
Yeah. So things happen like that.
Yeah, absolutely. Well, I think this is a lot of good information. Hopefully this will help a lot of people, get on track with some of these items. And I appreciate you taking time to do this. Do you have any parting words you want to mention?
Just want people to know what their benefits are and so forth. That includes not with the Navy and so forth, the military, but also what VA benefits are available. For example, we're talking about just the pay issue and so forth. I've had widows that come in, they're broke. What do? We send them to the VA. The VA has a widow's pension. So it's a low threshold, but you can deduct expenses to meet that threshold. So again, VA is a big resource. Take a look at your benefits, know what they are.
Okay, great. Well, I guess we'll leave it there. I'd like to encourage anyone watching to subscribe to our YouTube and Facebook channels. We'll do another webinar next month, and certainly we may revisit areas at some point. And Master Chief Dillon, I'd like to thank you for joining us and providing this insight. And again, thanks again. We'll do it again sometime.
And I just have to say, I appreciate you having me to talk about this morning. And if there's anybody out there that doesn't know an RAO or where they are and so forth, it's the phone number for Subbase in London, because we help people around the country. 860-694-3284. Bring us your problems. We'll get you help.
Absolutely. Well, thanks for all the work you do. And thanks again for stopping by.
Appreciate it. Thank you.
All right. Thank you all.